Good morning and welcome to the latest of the Flexible Space Association's webinars. This is our first one of 2021. I'm Jane Sartin. I'm the Executive Director of the association. And this morning we're covering the topic of mental health and wellbeing in the workplace, which is something that has been a topic our members have asked us to try and cover. And so really pleased that we've got a panel of people to talk about that. So in a moment, I'll introduce them, but just a couple of sort of housekeeping bits. First, there is a facility to type in any questions that you might have in the chat box, which is on your screen, and we'll either try and pick those up as we go along or at the end. And we've also put together a resources sheet of useful links on the topics that we're covering, and that can be downloaded from the event board, which you should see on your screen, and we'll also circulate that afterwards and make it available on our website. So if I can ask each of our panelists to introduce themselves, starting with Lauren.
Hi, so I'm Lauren Adams. I am the HR Director for the CBI, the Confederation of British Industry. So we're a membership organisation which work with a lot of businesses, probably including many of yourselves. But as an employer ourselves, we're an SME, so we're just under 250. And yeah, obviously I'm here for two angles really, kind of the membership and business aspect, but also as an employer. I myself have got unfortunately or fortunately experience with mental ill health myself, so hopefully we'll be able to draw on some of those kind of issues and how they've played out in my employment too today.
Okay, thank you. And the Flexible Space Association is a member itself of the CBI, and I know that some of our members are directly members as well. Alexandra.
Hi, my name is Alexandra Brunner. I'm the Chief Operating Officer for Clockwise, a co-working operator, currently having 7 locations across the UK. So therefore, is SME as well, but with big expansion plans. I've over 20 years experience in hospitality, so I've seen as an employee and as an employer the good, the bad, and the ugly. So and we're now in Clockwise, making sure with the team that we'll just be the great. I'd like to share that.
Great, thank you. And finally, Sami.
Hi, I'm Sami Hindmarsh, and I'm the Events and Admin Coordinator for the Deep Aquarium in Hull. I work at the Business Centre, which adjoins the big aquarium, and I'm also a mental health champion for the business as well.
Thank you. And the only one of our panelists with penguins on site today, I expect.
Just think of it.
Yeah. So I've got a few questions to run through, and as I say, if anyone watching has ones they want to throw in, then do add those to the chat box. So to start with, sort of overarching question is why is mental health and wellbeing something that employers should be focusing on? And perhaps we can start with you, Lauren, as the sort of employers organisation as well as within your own organisation.
Yeah, absolutely. I mean, oh gosh, there's just so many reasons. Obviously, on paper, the long-term business case that you'll have seen kind of HR teams and businesses go to your exec boards with are around productivity of the business. We know that healthy, engaged staff perform better, and that will impact your bottom line and all of that fantastic stuff. But I think that's all absolutely true. And we've seen, out of even, the 2008 recession, that businesses who had strong well-being and mental health action plans in place bounced back better and quicker. So when we kind of replay this into today's world with COVID and obviously what a number of businesses go through, we know that there's a really, really strong business imperative to take care of your staff and their well-being. Then from the human aspect and from the HR aspect, which obviously is a big part of my role, I have seen and experienced firsthand over the years the way that work and employment can be an enabler of good mental health if it's done properly. And it can be something that, you know, really, really supports people and can make a huge difference to their lives. But equally, if you haven't got those supports in place, it can be an enabler of poor mental health. And I think there's a really strong obligation on businesses and employers now to make sure, as Alexandra said, that we are on the right line of that, that we're on the great side. Because, you know, I've seen first and felt firsthand just, you know, having those small things in place can make such a huge difference, to people's lives. We spend so much time at work, and I think employers and businesses are uniquely placed to be able to impact just such a mass cross section of the population. So for me, there's the business need and there's the human imperative too.
Okay, thank you. Alex, would you add to that?
Yeah, I will probably add that if, as an employer, we don't make it a priority in our business, it'll become a priority. Usually, mental health only crops up on the list of priorities when things go wrong and you're too far down the line. It should be center of the whole process, from recruitment, from the way policies are run and how we run our business on a day-to-day basis. So it doesn't have to become a crisis or an unfortunate situation, because usually at that point it's too late.
Great, thank you. Sami, anything further on that?
I mean, yeah, I would obviously second everything said there about productivity. But I mean, the big thing is that mental health stretches way further than the workplace. Like Lauren said, you know, it's a real human issue. Workplaces where we spend a huge amount of our times, but a statistic that just came out from the NHS was 1 in 5 people are taking medication for depression, and that's just depression, and that's just medication. That's just people who have noted it. So that's a huge, and that's just in COVID times, and that's a huge statistic that's really mind-blowing. And it just kind of highlights the reason why it's so important in the workplace and out of the workplace in terms of remote working to stay mentally well, and the obligation now of an employer or of an organization to ensure that those safety precautions and that support network is there.
Yes, and work is perhaps even more all-encompassing at the moment when so many people are working from home. It's very, very challenging at the moment. So moving on to sort of more practical elements, it would be good to hear if there is an overview of practical steps that you've taken in your organisation to help improve the mental health and wellbeing of staff. And perhaps, Alex, on this one, we can start with you.
Yeah, I think first thing to do is really review what your current process is. Get the team involved on all levels from day one. Just asking them what they want helps. We've just done that recently and reviewed the benefits and have been able to replace some benefits that were barely used or weren't really of benefit to the teams and their well-being, and have been able to replace them with others that had a really great positive impact on them and on their wider life as well. So getting the team involved early and reviewing on how to best use your resources and put them into places where it has a big impact.
Okay, thank you. Sami, can you talk a bit about what you've done at the Deep?
Yeah, I mean, we're really lucky here. We've got a really strong sense of well-being at work, you know, a really dedicated team. And we, in 2019, in June, we signed the Time to Change pledge, which basically we pledged to prioritize and support mental health in the workplace, which was a big step. And even though before that it was a really big key issue, it really sort of on the public face of it as well was a fantastic step forward. And from that we created mental health champions, which sort of sit in most departments through the Deep, and I'm one of them, who basically are sort of beacons for signposting, which straight after we made the pledge, there was an increase in people asking for help at work. And that was a really big step forward in terms of how our organisation ran with mental health. I mean, other little steps that come from that. I mean, the support that we get from Mind, Hull and East Yorkshire is massive. The workshops that we get, you know, to be part of is fantastic. And then other little initiatives, for instance, you know, we initiated quiet rooms, quiet spaces, timeout spaces. We had sort of wellness bingo, you know, all these sorts of things that came out of it. That was a really key time for the Deep to sign up to Time to Change. So
and getting people talking about it and thinking about it as well by doing those things. And Lauren, examples from the CBI?
So at the CBI, we take kind of a three-pronged approach, I suppose. So the first element is as Sami's just said, definitely breaking down the stigma around mental health and making sure that it's led from the top. So we do a huge amount of kind of work to raise awareness around mental health and empowering people to be able to talk about it confidently. So we do a lot of comms, we do a lot of blogs, we do a lot of sharing experiences, signposting of aids, and we've definitely just kind of made it front and center, and we expect everybody from leadership down to be really kind of open and communicative about it, and it's built into organization objectives and all of that stuff. The second thing, which I think is probably really relevant to today, is this piece around early intervention. So it's definitely, as Alex said, it's trying to put things in place so it doesn't get to that crisis point. So we promote a lot of free mental health apps. We promote our employee assistance program, our private medical insurance. We've worked quite a few benefits providers to just make sure that we've got, I suppose, tailored but accessible mental health support for a range of people, because some people won't feel comfortable going to their GP. Some people won't feel comfortable talking face to face. So some of the things that we've got are more like online apps that they can kind of text on and WhatsApp and things. So a huge range really, and drawing on a lot of freebies that are out there as well, which is always helpful at an SMA and in particular, I think. We also, you know, similar to what Sami said, we, in the prevention piece, have got our mental health first aiders, and I won't talk about them too much because I think we probably will throughout this conversation, but very similar to the champions, they work with managers to just, and with staff to just be able to spot the signs that somebody might be struggling, have that conversation and signpost them to the relevant support. And then the last thing that's kind of key and is critical, I think, to any business who does this well is making sure that your managers are equipped, because it is such a difficult, you know, and complex matter. You want them to be able to have those conversations sensitively, helpfully, and also to just not feel overwhelmed themselves with it, because it is quite a big responsibility. I feel that as a manager sometimes, and I've been on the other side of it. So, you know, a lot of support for managers and training where we can. And another big thing, which has just been fantastic for us, is making sure that each team has their own personalized mental health action plan. So it's just a really simple document that the team create with their manager to just kind of think about tips and tools when their mental health is struggling, anything from go out for a lunch, a walk at lunchtime, through to, you know, quiet times, whatever it might be for that person. So that's our approach, kind of three-prong, and it's worked really well for us over the years.
Okay, thank you. So we've sort of touched a bit on how you're generally SME organisations yourself, but a lot of our members are really small in that they don't have their own HR departments or the other sort of internal resources. They're very small organisations, but they do have a number of staff. So this is still an important topic. Do you have any tips for them on simple steps they can take to improve the well-being of their staff? Perhaps Sami, start with you on that one.
Yeah, I mean, we're probably going to touch on this a little bit in a bit, but you know, as obviously a business centre, we're sort of a key point of contact for a lot of our businesses. And one key area that we've been focusing on is just that awareness, is that constant making aware that we all have mental health. It's not always bad for everyone, but we all have it. And the simple thing is that what I've been saying to a lot of businesses has been, you're already supporting mental health without even knowing it. It's the simple things like smiling at people when they enter the building, saying good morning. Those very small things can are totally free, totally fine, and just make someone's impact really large, especially now in this current circumstance when you might be the first person they see that day. Those sorts of communication are key, and I think that's probably what on limited or to no budget or limited to no staff, dedicated staff on the subject, communication is key through all of this.
Yeah, so sort of the right type of human contact in a sort of positive way, even as something very simple that we can all do in our day-to-day lives in all sorts of ways. Lauren, have you got any tips for smaller companies on this?
Yeah, I'd echo that, and I think it's using who you've got as your staff as well, and finding those champions, and being able to just draw on external things that are already going on. You don't need to reinvent the wheel with a lot of this. I mean, even the Mental Health at Work website has got so many materials on which you can just download and steal from other organizations because they want you to have them, because they've already done that thinking. And yes, you might need to tweak it a little bit for your organization, but why not just look at what's out there already. You don't need to reinvent the wheel with these things. A lot of the things that we've done as well that have been most effective are the things that have taken the least time and least resource and the least brain power, to be honest. It's things like a buddy program. It's things like just setting up we call it coffee roulette, where basically we just match people in little groups to catch up and have coffee every week or so, to just replace those kind of, because we're all at home, those conversations that you used to have around the office. It's just those simple little things. But again, I come back to making sure your managers are equipped to have those conversations, and everybody feels confident too, because they're the kind of the enablers of a lot of this. But yeah, there's a whole lot out there that you can steal, and it doesn't take a huge amount of resource, I'd say.
Yes, it's perhaps sort of not being scared of the subject, because there is a lot of help there. Alex, anything that you'd add finally?
I think especially for SMEs and smaller businesses, employers always think they have to be the ones who initiate everything. So what I would probably say is, and encourage employees to go on sites like from the charity Mind. There's a questionnaire on there that you can fill out, and you can take it to your employer and say, look at this, and I think this will be a decent action plan. We always think we have to do everything for our employees, and rather than trusting them a bit and saying, can we do this together, or can you help me with that? So I think that's probably the biggest tip for especially smaller operations.
Okay, thank you. So sort of linked to this, and Lauren, you touched on this before, mental health first aid and maybe other training in this area. Is that something you'd recommend, or any other schemes on that?
So yes, if you've got the budget and you've got the resource, then yes. We do it as the CBI, and I've been a mental health first aider in previous organisations. But I'm well aware that it's not a possibility for some people, because you need to have a little bit of budget to do that. I think that if I can be honest, they actually, as a group, only really came into their own during the pandemic. We probably weren't utilising them a huge amount before, but they have been invaluable in just having those informal check-ins with people, and just being there as somebody more on a peer level, rather than it being their manager or HR that they can just reach out to and say, oh, I'm struggling a bit with this, can you signpost me in the right direction? Or sometimes they'll flag, oh, I'm a little bit worried about Joe Blogs, what do I do here? So they have I can't lie and say they haven't been incredibly useful for us during the pandemic. But I do equally at the same time think that you could probably do very similar if you haven't got the budget, just through upskilling, a small group of yourself from some of the materials from, say, Mind or elsewhere. And it's just about having those people who feel a little bit more equipped to have those conversations. They're not there to replace medical advice. They're not medical professionals. It's just about recognizing the signs that somebody may be struggling and being able to signpost them in the right direction.
And Sami, I think this is something that you have experience of. Is it something you'd recommend?
Yeah, I mean, having done mental health first aid and having a few of us here, it is a key. And I think the thing that really stands out for me is the fact that an organization often has sort of action plan. A bit, Lauren has this down to a T, it sounds like, but having action plans for physical health and safety in the workplace, you have multiple different sort of policies, procedures and all that. But well, according to the new NHS executive for mental health, very, very few workplaces or organizations have an action plan for mental health. That's key, really, especially for if you have more than 10 employees. You really need an action plan, and that's what having mental health first aiders can just put in there. We've been really lucky in the fact that we get together and we talk about how things are and what's going wrong, where is it going wrong, and been able to just implement those tiny changes that just make people's lives better. And along with that, the training. I mean, Freya, the head of business and corporate, has really great connections in terms of she's laid that groundwork to be able to reach out to other companies. We've got companies in the business centre who are ace at it. We've got Andy's Man Club, which is a suicide prevention group for men, and the First Ladies, which is a suicide prevention group for ladies. And I've been able to sort of nab some side training off them when they run their courses, just get into a room and just watch the videos, learn from people, listen to nurses, listen to health workers. And so, having those, reaching out to those other companies, like Lauren was saying, is a really great way of utilizing budget. As a charity, we don't have huge amounts of budget for anything, really. So, we're constantly trying to find those ways to be frugal, but make sure that we're supporting mental health, and those have been really key for us.
Yeah, so sort of taking opportunities and looking for opportunities as well, and there are a lot of free resources out there. Alex, is there anything else that Clockwise are doing in this area that you'd recommend?
So we have taken the strategic approach to make sure that we have mental health first aiders in each of our buildings. Out of the simple reason, each building has their own microclimate, their own microculture. And it's really important that there is a building of awareness and training and knowledge and experience in each of the locations to make sure that any sort of warning signs are being addressed straight away, and that it really filters through the entirety of the business from the top to the bottom. From Belfast, down to London, across the entire estate. So I think for me, the mental health first aider training has been really invaluable for the team. They've been raving about it afterwards. They've been hugely engaged, and we can see some really great conversations coming out of that. And we have been able to facilitate most of them with our partners during the pandemic in lockdown. You don't need to get into one room together to have those meaningful conversations.
Yeah, that's all really helpful, I'm sure, as sort of advice to people watching. So in different ways, you're all at organisations that have a focus on customers or members. have you found ways to extend wellbeing support to people who aren't directly employed by your organisation? Lauren, perhaps start with you. And actually, we invited you to join this webinar after a colleague had watched a webinar that you were doing at the CBI, so that sort of proves itself. But are there other things that you're doing as well?
Yeah, so obviously we have been doing webinars, and definitely keep an eye on the CBI website and Twitter and LinkedIn and all of those social media things for when we're promoting that stuff. But we've got a report which sets out how people can create a mental health strategy called Front of Mind. You can get that off our website. And there's also, again, just a bunch of free resources, signposting, and I guess I hate this term, thought leadership, on mental health. So yeah, we've kind of just made them as accessible as we can to not just members actually, but the wider business community as well. So yeah, there's quite a lot of stuff, and we've also got at the CBI kind of as part of our people and skills policy team, dedicated policy resource as well, which if you're a member, then you can tap into.
Okay, thank you. And Alex, is this something that Clockwise look at with your clients?
Yeah, we do. I mean, we'll send out every Friday a Wellbeing newsletter. So it's not a sales tool to our members. We're the home for hundreds of small and medium-sized businesses. So I can see from the readership and how many people are engaging with it that it's a dearly loved support on a Friday afternoon for a lot of our members. But what we also do is we're working with a company called Mind Up, which is a great tool that allows mental health support for our employees. And for a lot of businesses, it's unattainable to purchase something like that. So we've set it up in such a way that our members can benefit from it as well for their employees. So any initiatives that we're doing for our employees, we strongly believe that we'll just push it out to our members as well to give them the same opportunities.
Great, thank you. And Sami, anything to add to that?
I mean, in terms of clients, I won't delve too much into the customers of the aquarium, but in terms of clientele, before the pandemic, because this is going to last past the pandemic. I keep thinking about the pandemic, but it's going to last past that. Mental health is an eternal thing. So, before the pandemic, we did our Time to Change Day and our Mental Health Awareness Week and Mental Health Day. We extended them to clients. We had a room filled with cake and coffee, invited them in, chatted to them, gave them resources there and then, because we found that a lot of companies won't necessarily reach out. A lot of our clients won't necessarily reach out in terms of mental health. Some are very good at, making aware, but giving that opportunity to them has been really great. And companies, it was a great way to meet people, but two, it was a fantastic way to sort of open up these conversations and have a smiley face there and say, it's not all doom and gloom. There's great resources, and even if you don't need them now, it's great to know, to be able to reach out that arm and say, here you go, there it is.
And have you, Sami, has any particular successful initiatives during the pandemic that you can touch on this subject?
I mean, that's a really good question. I think that we have extended conversations to our clients during COVID because we haven't been able to do the nice events with cake that we would want to. We did I think it was the last Time to Change Day or last Mental Health Awareness Week. We did an initiative where we reached out and said cake at the desk, I think it was called, or coffee at the desk, cake and coffee at the desk. And the idea is that people take a picture and send it in to say, I'm here and I've got the cake, and what cake have you got? And just begin those conversations. We found that food is a great way to bring people together, as and start talking, and eventually those conversations evolve. But also just to make people talk, just to get those conversations back. It doesn't have to be an immediate conversation. It can just be a post on Twitter that people interact with, or a poll on Instagram, on LinkedIn that people start engaging with, and those sorts of engagements are really great for people who are not that hot on verbal conversation. A lot of people communicate non-verbally, but also seeing pictures again helps with the non-verbal, helps with the sense of another human being there alongside you in spirit, if not in person.
Yeah, and although I think we've got generally a lot more used to talking to each other over screens over the last year, it's still not the most natural thing, is it, for anybody really? Alex, have you got examples of successful initiatives during the pandemic that Clockwise have undertaken?
Probably the one that was most successful, and also the absolutely cheapest, because it didn't cost us a penny, was we introduced the wellness hour. So we gave every employee an hour a week. It didn't matter when they wanted to take it. They could take that hour during the working time. And the only premise was that they won't be working at that time, and that they just focus on themselves and what makes them happy. And if they wanted to, they could share it with us. And oh my God, we got overwhelmed with posts and videos and stories and thank yous from a little brother, because the sister surprised him out of Sartin for a birthday lunch at McDonald's when he could stay go. Others were going out for a run in the morning, or just for a stroll, or managed to get to the hairdresser, or finish early. It was just so varied. But it wasn't only the hour, it was then the sharing of what was the decompression for them out of work, and sharing the non-work piece. That, yes, it's something that was absolutely amazing, and something that we'll probably continue to do, because really, it was very overwhelming to see all of those.
Yes, I saw some of the posts on LinkedIn from Clockwise staff, and there was some really, I think a donkey sanctuary featured at one point. I remember seeing.
Yes.
all manner of things. Lauren, have you got an example of successful?
Yeah, I'm gonna cheat and give two. The first is more an approach, but just something that I think is important that we haven't touched on, is we made sure we were paying attention to, I guess, how it could impact different groups of employees. So we paid a lot of attention to working families, and we worked with our working families network on that. And we've kind of got a few initiatives just tailored for those who are caring. We've got dependents through the pandemic. Same, we worked with our race and ethnicity network, because we know obviously that they've been disproportionately impacted by the pandemic. So again, we've had a few separate things for those. So we've made sure to still look at it through quite a few different lenses, which I think has been important and really well received by our organisation. On the quick wins, and again, it was a freebie. In December, it doesn't have to be December when you do it, I did a Wellbeing advent calendar. So every day I just kind of thought of a Wellbeing tip and just sent it out on our internal comms. So just simple things, again, like Alex just said, go for a walk, think of 3 things you're grateful for. It doesn't have to be December. I just did it because of Christmas advent calendars, whatever. But it's a nice thing to do for probably at the minute as well, actually, when people are down during lockdown, and people really like that.
Yeah, that's a sort of easy initiative to undertake with fairly minimal, but could have a real impact. So sort of looking ahead, obviously a lot of people have been working from home. Will be at least a year probably by the time that sort of begins to move back to the office, and they might be feeling anxiety at the thought of that return. Do you have any advice on how this can be managed to ensure that staff have that support? Lauren, perhaps start with you on that one.
Yeah, I know actually that the Money and Mental Health Institute just did a bit of research on this yesterday, which I haven't read yet, but this was one of the key findings, that people who have got pre-existing mental health conditions are in particular very anxious about the return. And it's interesting, even for myself, I suffer from, when my anxiety and depression is bad, insomnia, and it's been a real lifesaver to not have to get up early hours of the morning if I haven't slept overnight, to be able to just not have that pressure to go back. And I'll find it difficult, I think, to adjust back into that mode. So I'd say it comes back to those good conversations. I think businesses should be, and managers should be having almost return to work conversations like you would with somebody who's been on long-term sick, almost, to talk about how they return, how they want to return. Are there any reasonable adjustments that they might need? Is there anything that's making them particularly anxious? I think it will differ for different people. For some people, it might be being away from their family that they've been close to for a whole year. For some people, it might be the thought of getting on, the underground or the commute again. For some people, it might just be, generally, gosh, we just haven't interacted with people for a year. How do you do that? And have people had the vaccination and whatnot? There's just so many different things to consider. So I think not rushing into it and taking quite a structured plan to it, and engaging staff. If you've got a staff forum, talk to them, engage staff, survey them as much as possible, if you can. So it's not just bang, we're back to work, you've got to come back to the office. It's done in a bit more of a sensitive and an appropriate way.
Yeah, no, it's sort of a different world, isn't it? It's odd now looking at television dramas and seeing normal life of crowds of people and things, and feeling that looks quite alien. So that return will be difficult. Alex, have you got any thoughts on this?
I'd echo what Lauren said, especially around the communication piece. This is more than one conversation. This isn't how do you feel about it? Let's do a tick box and see, who's ready to come back or not. I think what I would also add is look at your workspace. I find that a lot of people are now way more sensitive to noise and disruption from their colleagues when they're working in an office. We have spent the last 12 months in an environment, whilst we talk a lot on Zoom and everything else, in an environment where when we do focused work, it's probably very quiet around us, apart from maybe the pets and the kids and everything else. But we're not used to other people might be on the phone or having other conversations. And we might have lost some of our ability to sort of blank that out and looking at ways on how to address that, because that can cause a lot of stress and anxiety within teams.
Okay, Sami, anything you'd add to that?
I would echo on Lauren and Alex's points and just say that, use the resources that you have. We're lucky that we've got the first aiders. We're lucky that we have the champions, and and then often, I think pretty much as often as possible, they're frontline staff, and so I've had conversations constantly over the pandemic. Most of our staff are furloughed rather than remote working, being a public attraction. And so, having those conversations, just sort of checking in, I've just been doing that. And so that I know that the stresses that they're having, thinking about coming back, and I'm able to feed that back to senior leadership and to the managers that need to know, because they don't have 70 million ears to be able to hear all of the people, but I have that time and that ability to connect with them and to understand what they're thinking. So before we come back, before we get ready to open, it will be a matter of saying, right, well, these are the conversations that I've had about the anxieties of coming back to work. And so, utilizing that front line, utilizing the champions, the first aiders, the whatever you may have, ambassadors, using them can be key to them coming back to work.
Yeah, no, that's a good point. It's also not just people that have been working from home, it's people that will have been furloughed for quite a while and be out of that routine as well, and returning to hopefully sort of normal life again. So we're getting towards the end. We had when we invited people to register, we asked if they had any questions, and someone asked if you had any advice for people who are alone working and what you can do to maintain well-being. And I suspect quite a lot of what we covered would be applicable to people working on their own. But Alex, have you got any thoughts on that? scenario?
Probably the key piece is to still make them feel part of the team. So probably the best thing to do is to make sure that you plan in some time to just have a chat, not to have an agenda, getting on a call and saying, right, these are the, 3-4 things we need to talk through today, but actually giving it time to just have a conversation. Because if you're a lone worker, you don't have as much people interaction anymore as you may have had in the past. You can feel very isolated. So having that conversation with them, that check-in, that is unstructured, but that just gives them that space they can fill, I think that is probably the biggest help you can give them.
Hey, Lauren?
It's really interesting because we've been talking about this a lot over the last 2 weeks, actually, because of feedback we had from our staff about our well-being approach and whether it was more targeted towards extroverts or introverts, because they want quite different things. So some of the initiatives that we'd been originally thinking to address people who were lone working, things like the coffee roulette and matching people for coffee chats and things like that. Some people were actually quite nervous about, and they didn't want to have their cameras on, and they didn't want to be, forced into doing it. So I think giving people a choice with those things has been a reflection of mine over the last week. I know it's not really answering the question, but it's something that's been on my mind. We've also thought about it in the sense of lone working in the office, because we have had one or two people who've continued to go into the office because of various circumstances, either their role or at home, and that's been quite odd for them, having to go into what would have formerly been a really big, busy office, and they're just kind of sat there by themselves. So making sure that you've got, if you're in that lone working category, that someone always knows where you are, that the health and safety stuff's still all set up, and that you're still reaching out to people, especially if you're a manager, reaching out to them and just checking that they're okay. So that was something that we did on the office lone workers, which has been something for us because we tended to have at least one person in each office. But on the other side, I think it's been a mixture of, as Alex said, trying to maintain those social connections, but making sure that for the people that doesn't appeal to, that there's another option for them, and it's maybe more one-to-one.
Hey, Sami, that's probably covered quite a lot of ground. Is there anything that you'd add? Yeah.
I mean, the only thing I'd say is that, we in the business centre, we usually have a team of 3 working over here, and now we've got a team of 2, which the one, we've lost a third of the workforce, not lost, but they're on furlough. We've just come up with our own things. I don't even know if we thought of it as mental health wellbeing, but looking back, it probably is stuff like the time Freya and myself were living alone in our own houses, and so we thought, right, well, rather than going home and cooking a big meal, we'll bring one in each other day. So we started cooking for each other. Freya, obviously living alone with her dog, started bringing the dog in for the wellness of the dog and me and all of the other clients as well. Just little things where we have a lot more flexibility to be able to do these things now. And so it's not lone working as such, that being isolated from a lot of what usually happens. It does feel nice just to be able to start doing things that wouldn't necessarily usually work, that just boost the sort of morale a bit.
Yeah, and I know that quite a number of our flexible workspace operator members do allow dogs into their offices and see that as a well-being area and for everybody. Unfortunately, the office we're in doesn't. So my colleague's dog we can see on the screen at the moment, which is very nice, but it would be quite nice when it comes to the office. So as a sort of final question, can you each give one top tip that people can use today to start the process of improving the mental health and well-being in staff in their workplace? And start with Lauren on that.
Oh gosh, I don't know. I think if I go back in time, it was just starting the conversation. So breaking down the stigma. I think that is the first way, especially if you're part of an organisation where it hasn't been part of your DNA before. Finding somebody or a few people who are willing to start that conversation and share their experiences for us was a real turning point.
Okay, thank you. Alex?
Probably something I've taken away from a forum I was on just a couple of weeks ago. The Meta study that came just out over in the US, sat on a forum with them. And the top answer that came out in regards to changing the environment in the workplace and how people feel was something they coined as workplace decency, which was around being present in conversations, taking that time to really sort of be in the moment rather than trying to do 20,000 other things, emails, little messages cheekily on the side, etc. It had to do with making sure that when you are back in the office, that if you're going out for a coffee, that you're making sure you're getting a coffee for all of them. So it is the, and that's why I like the word of workplace decency. It is just to be aware and respectful of everyone in the group and in the surroundings and in the team, and don't ever feel that you're leaving somebody out. Because it was for the majority of people that responded, and there were over one of the biggest workforce studies that was done now in the last year. And for all of them, it had to do with all of these small pieces, these small moments where somebody just didn't pay attention or didn't think and hurt somebody's feeling, and it's not being mentioned then, and it starts grinding away, and that's how things start. So yeah,
okay,
that's probably it.
Thank you. And finally, Sami.
Yeah, I mean, it kind of bounces off, for me, it bounces off what Lauren was saying at the very beginning about sort of the way that they sort of monitored and evaluated the mental health in CBI. And that is a kind of key thing, I think, is first off, you need to know what your workplace looked like, the kind of map of your workplace in terms of what are the the bottlenecks of ill mental health, what's the department that has people flailing in that area, is there support there, and then to build on that and say, right, okay, where does need the support, because there's no point in throwing support everywhere willy-nilly. You might as well really look at it, really evaluate where it is. And there's a fantastic, annoyingly, I didn't remember where the new initiative was, but I saw it on LinkedIn. So if you sort of search through a LinkedIn hole, you might find it. It was that they have a new way of monitoring, a proposed way of monitoring, where it's employees wear wristbands and just tap on one of the things whether they're happy or sad. And that's a very basic, very, very basic version. But it's a really interesting way to sort of kind of see throughout the day what kind of time of day are people feeling down? Are people not feeling happy? Is it when they first arrive? Is it it's lunch? And so you can just really get a good map, a good sort of timeline of people and their mental health. And so that's probably the big tip that I'd say that we've really benefited from here.
Okay, well, thank you very much. I think this has been a really interesting discussion, and I'm hoping it will be useful to people watching. If people watching have thought that and want to share it with colleagues, we will be putting this onto our YouTube channel probably later today. So thank you very much to Lauren, Alex and Sami for giving us your time this morning. We're working at the moment, I think, on 2 or 3 further webinars that will be coming up, and we'll be sharing information on shortly, so keep a lookout for those, and thank you very much and have a good rest of